Hi everyone, I'd like to go over ultrasound versus optical biometry. So when it comes time to have cataract surgery, your surgeon will do measurements on your eyes. Now, the reason why is because every eye needs a different sized powered lens. So here is the eyeball. What your surgeon is going to do is he or she is going to measure the length of the eye. Now I'm just kind of simplifying this, but taking a measurement from the front part of the eye to the back part of the eye. And based on that measurement, the surgeon can determine what size lens to put in. You might need a size 22, or you might need a size 18. Some patients might need a size 16. Now, obviously, let's assume you're truly a size 17. Let's assume your eye needs a size 18 implant. You're hoping that during your cataract surgery, when the cataract comes out, you're hoping that your surgeon is going to put in a size 18 diopter lens. If your surgeon accidentally puts in a 16 diopter lens, well, you're not going to be very happy. It's like as if you're wearing the wrong glasses. So how do we determine the right lens power or the right size for your eye? As I said, your surgeon will give you the option of having ultrasound measurements or optical measurements. Think of them as two different rulers. And what these technologies do, as I said, is they measure the eye from the front to the back. They also measure the power of the front part of the eye. And based on those measurements and a few other measurements, it can provide information to your surgeon. Now, ultrasound is the older of the two technologies. It's the similar technology that we use on pregnant women. So the ultrasound probe will sit on the front part of the eye, and then it will send ultrasonic waves to the back of the eye. It'll bounce back, and based on that information, it will tell your surgeon what size lens to put in. Optical biometry uses laser. Now, what is the difference between the two in terms of accuracy? Well, technically, optical biometry is a bit more accurate. So what does that mean? Well, going back to what I was saying, let's assume your right eye, for example, truly needs a size 15. Okay, if you put it a size 15, you'll be very happy. Well, there's a possibility that the ultrasound may not tell you the surgeon to put in a 15 diopter lens. It might tell your surgeon to put a size 14, or it might tell your surgeon to put a size 16. Your surgeon will go based on what the report says. So, and sometimes the ultrasound is accurate, but when it comes to optical biometry, if your right eye truly needs a size 15, well, odds are that optical biometry will recommend a 15 diopter lens. You have a much higher chance of getting the measurements right with optical biometry. Now, ultimately, we usually leave it up to the patient to decide between the two technologies. But in terms of accuracy, the optical biometry is more accurate. And the reason why this is so important is because the end result of the surgery is not just how well you can it's not just based on how well the surgery goes. And so let me explain that a little bit further. So here's your eyeball, and this is the cataract, okay? So your surgeon will go in and take out the cataract. He or she will leave the eye with the residual bag, and I've explained in my other videos what this capsular bag is. And then your surgeon will put in the implant, okay? Now, the surgery can go uneventful, the cataract comes out nicely, the implant goes into the eye very nicely. But how well you see is not just based on surgeon skill on removing the cataract and putting in the lens, but how well you see is also based on what sized implant goes in. The surgery can be flawless, but if you really needed a size 14, but your surgeon put in a size 15 because perhaps the ultrasound was suggesting a size 15, then even though the surgery was uneventful, how well you see after will be less than optimal. And so that's why eye measurements before cataract surgery are so important. They play a huge role in how well you see after, and your surgeon, again, will go over these options, and ultimately it's up to you to decide on what technology you want to use. Anyways, I hope you found this video to be useful. I have other similar videos, patient educational videos on cataract surgery on this channel. Thanks for watching.